tell us the differences between an endemic and a pandemic.
Or even epidemic.
Sure.
Yeah. Well, let's talk about pandemic. That's a global kind of thing that usually involves the World Health Organization, WHO, that declares a pandemic when it's a world. It's not just in the United States. It's not just a localized outbreak. It's an infection that is going on all over the world at the same time.
And in fact, that's what the word pan means, like in panorama on a photograph.
An endemic is more of a natural environment where you see a disease like coronavirus has been in bad colds for quite some time, but we've lived with it.
Right.
Malaria has been in a lot of Latin American countries and Africa and different places where people have learned to live with malaria, with protection from mosquitoes, especially that Culex mosquito. And you used to say you don't have to worry about it except the female mosquito, because the female mosquito is the only one that bites and needs blood for the eggs. But who can distinguish between a male and a female mosquito?
Yeah.
But you have to be concerned about living in a world that we hope to get to shortly, or at least in the next year, where it's endemic. We still have coronavirus, but we're living a more natural life than what we're living in a pandemic that's still sprouting out mutations and still coming out with different forms of the virus and the strains that we call. And we will see some more strains come from this.
Oh, we definitely will see that. And we just have to pray that they're not aggressive strains, or that the people of our society will accept vaccination. I have 2 scars on my arm, and those scars were made for me to get into first grade and into high school. And I got those scars for smallpox because when they injected my arm, they literally stabbed it 36 times in the circle of a Roosevelt dime size. So I have a permanent scar, which is my vaccination record.
Yeah.
They could have injected it in my muscle, just like this vaccine, but I needed a physical vaccination record, proof that I had that, and that's why smallpox has been eradicated from the world. And you know, when that vaccination was up, there was just as many people protesting that it was the mark of Satan, like some evangelical ministers are claiming inappropriately, or that it's a political reason, the government's forcing it upon us. And that existed back then. However, it was mandated back then, which is the only reason why that disease doesn't exist anymore. So,
a good point. And you know, during 9/11, we started vaccinating a few of our nurses again with smallpox. Nobody knew how to use the vaccination method that you have to use, which is a scratch-type vaccination. But we did revaccinate because we found out the immunity was not still there, and we needed some health care providers that could protect the public. Now, we've often heard, and we're getting off the subject a little bit, there are 2 strains of smallpox still in the arsenal in the Soviet Union and the United States. They could be used for bioterrorism, and that's been a concern. But being eradicated is a major thing. The breakthroughs I also wanted to talk with, just a little bit with the breakthrough. You know, that's one of the defenses that I hear occasionally, that people, I'm not going to get the shots, or because I know neighbors, know friends that have gotten the virus anyway. Let me assure you, just as the doctor did, the severity of this condition will be greatly lightened, less if they've had the shots and the booster shot. They might get it, but the chances of dying, as you talked about, are greatly reduced. And if you offered a shot for a number of diseases like cancer, diabetes, and a number of how about heart disease, when you jump into the plate, if you said, I've got an 80 or 90% chance of not dying from this if you'll give me this shot.